All right, everyone. So thank you very much for coming to this webinar. I am Nabil El-Ghoroury. I'm the Executive Director of CAMFT. And right now, it's my pleasure to host this webinar. With me, I've got two of our attorneys. I've got Kristin Roscoe.
Hello.
And I've got Bradley Muldrow.
Hey, everyone.
They've been on CAMFT staff for Bradley for a year, and Kristin celebrates her anniversary in a few days. So we are very excited and grateful to have them on staff. So first off, I want to wish everyone's health and safety as we are in this pretty significant crisis. And so I hope everyone is quarantining at home and physical distancing. And that's kind of the reason why we're here, because we're talking about telehealth. So we have a 30-minute Q&A. We've already got a few questions before the session. We have some questions to start off the conversation. And then please type in your questions into the Q&A. What we're going to do is we're going to focus the questions on telehealth. So if you submit a question that's not related to telehealth, we may not answer it. So we encourage you to, if you are a CAMFT member, to call CAMFT and get a consultation on those questions. And then questions that are partially telehealth and partially not, we will address the telehealth aspect. So I want to thank everyone. We've got so far 720 participants. So thank you to everyone. Please put the questions in the Q&A, not in the chat. But feel free to use the chat to send messages. There's a lot of messages going there right now, and I'm not going to keep paying attention to that immediately. But I will look at the Q&A sections. So we're going to start off with my first question for Brad. And that question is, and I got to open up, I have too many files open up. Okay. So our first question is, let's start with a poll. We've got 740 people, so let's start with a quick poll. This is just a fun question. We'll have another more real question in a little bit. So Eileen, would you post the poll? So this question is, what's your quarantine superpower? And what's the superpower you've discovered since sheltering in place? Snacking with reckless abandon, being at peace with the dust accumulating on your car, or hosting virtual sessions with patients like a champ? So feel free to click your answer there, hit submit, and I believe we'll be able to post the answers. This is just a test also to see that everyone can do this. So click on the poll to put your answer, not in the Zoom webinar chat. I know I'm driving so little right now, and gas prices are so low. It's painful to see like, these prices. Like I filled up at $3.35, and it's too. Or I don't know. I don't know what price.
You and me both.
Okay, so the answers are 42% are saying hosting virtual sessions like a champ.
Oh, snacking lost. Oh my gosh.
And then another third, each of you said snacking with reckless abandon or being at peace with the dust. I'm snacking. Yeah. I don't know about you. I'm snacking. In fact, I have some snacks right here. Okay, so let's go to the first question. So Brad, have any of the telehealth requirements changed due to COVID?
And so one of the main requirements that have changed is going to be that from a legal standpoint, you're no longer required to gain informed consent, either verbally or in writing, for telehealth. Ultimately, the governor issued that via executive order. That's not a recommendation that we make. It's typically not going to be an emergency situation where you have to jump right into treatment without gaining informed consent. So at the very least, gain informed consent and document is going to be best practice, but at least until the crisis is over with, there isn't going to be a requirement for informed consent for telehealth. And there's also going to be some updates in terms of HIPAA and video conferencing. They've relaxed some of those rules, but I believe they will be addressing that a bit more in later questions.
Okay. And then Kristin, the second question is, can a HIPAA-covered entity provide video conferencing telehealth services via a non-HIPAA compliant platform?
For the time being, yes. So a month or so ago, the Office of Civil Rights, which is the federal version of the enforcement body over HIPAA, said it is okay for telehealth providers to provide those services over non-HIPAA compliant mechanisms. So they specifically called out certain platforms such as Zoom as okay, or FaceTime is okay. What they definitely said is not okay is anything that is a publicly facing platform. So don't go and Facebook Live your telehealth sessions, but as long as you're making good choices and still, recommending that your patients have good confidentiality with the platform you're choosing, you're okay for the time being. And again, it's only for the time being.
So no Instagram.
Well, I mean,
not quite yet. No TikTok therapy.
Not quite yet. Okay.
Let's be clear. No.
Therapy on the
Okay.
gram.
Then the next question is for Brad. A lot of patients have made the decision to shelter in place outside of California. For example, students attending UC or Stanford and may have gone home, but may still have a therapist in California. Are therapists permitted to still see their clients?
The answer is everyone's favorite response, which is it depends. Ultimately, where the client's state of residency is not really the issue for telehealth. The issue is that your California license only authorizes you to practice with clients who are physically located in California. And so if a client is sheltering in place elsewhere, you want to check with that client's state licensing board to make sure that their state law would allow you to work with the client on a temporary basis. And we are seeing that different clients or the different states are authorizing via executive order the ability to practice across state lines as long as you're licensed, but you do want to check in on that issue with the state licensing board. And we have a resource on CAMFT that is actually going to help you with that. If you go to our COVID-19 update document and click on the general telehealth FAQs, you'll see that we have a PDF document link that lists all 50 state licensing boards' contact information. So reach out to the state licensing board to make sure that you wouldn't be violating a state law in a different state. The other issue is making sure that your malpractice carrier is on board. Typically, they're going to be okay with you providing telehealth to somebody who's in a different state as long as you're following that state's law. But it's always good to check just to make sure by calling your policy carrier. And the last thing I would say is that there are some people who are sheltering in place in different countries. And so even though we don't have information about different country licensing board, there is an organization that you may want to check out their website called the International Association of Marriage and Family Counselors. That's the International Association of Marriage and Family Counselors, and see if they have any resources on whether or not you're lawfully able to practice in a different country.
Okay, that's great. And I want to remind folks about the link on the website to find other state licensing boards. It was posted earlier in the Zoom chat, but I see the Zoom chat is zipping along. It will be posted again, and we will have it on the website, obviously, camft.org. Click on the FAQ for COVID. Okay, so to Kristin, if patients use insurance, will in-network therapists be reimbursed for providing telehealth services?
They should. So we worked really hard with the governor and some of the insurance companies to ensure that right now, again, one of those for the time being, insurance companies have been required by the Department of Managed Healthcare to provide reimbursement to therapists for providing video conferencing and telehealth services at the same rate as face-to-face sessions. So they should, and they've also been recommended that they should be removing any barriers. So if there were administrative hurdles that insurance companies required you to undertake before offering telehealth services, in theory, those should all have been removed at this point in time.
Okay, so now I'm going to start going. So those are the questions that we had planned to start the conversation. I'm going to go with some emailed questions, and then I see we have 68 questions in our Q&A. So we're not going to get to all of them. I can tell you that, but we're going to do our best. And I believe we are recording this session. Just want to remind folks. So if you are having audio problems, I see some people cannot hear us well. This will be recorded and you can come back and listen to it. We'll have that posted, I hope fairly quickly. Okay, so questions. Okay, so I'm wondering if a question about counseling people in California when the therapist is on vacation or sheltering in place outside of California. So licensed in California, but temporarily not in California. Can you conduct telehealth sessions with clients in California?
That also depends on state law. And so for most states, the answer is that all that most states care about is whether or not you're offering therapy to a client who's located in their state. But there are some states, like I believe Kristin mentioned one time, that New Hampshire, for example, has a requirement that whether you're going to be practicing with a client who's in New Hampshire or anywhere else, if you are a therapist who's physically located in California, they consider that to be practicing in their state, so they would not allow that. So you'll want to use that document that we described earlier to contact state licensing boards just to make sure that they're okay with you practicing in their state, or rather with clients who are in California. Although states are generally a bit more open to that, but you still want to check.
Okay, thank you. This is for Kristin. Is signed authorization needed to conduct teletherapy?
No. So as Brad mentioned earlier, right now the governor has issued an executive order that's been in place since, I believe, April 3rd, that has suspended the requirement for any type of informed consent. So typically you could have either verbal or written informed consent. So that requirement has been suspended at the time being.
Okay. So I'm going to start going through some questions. One question from Jim Brillon is, I have clients that want to use Venmo for telehealth payments. Is this HIPAA compliant?
That's another it depends question. And so if you're a HIPAA covered entity, then if you're going to be transmitting protected health information of clients via Venmo, and so if for some reason in the memo or in the comment section for Venmo, you're indicating this is a payment for therapy, then that's going to be transmitting a PHI of clients. But if you're going to just be charging the client through Venmo without indicating what it's for, and perhaps offering the client that if you would like to have a paper invoice that discusses in detail what the payment was for, then kind of providing them that separately. But as long as you're not transmitting any client information, any information to indicate that this was a payment for a healthcare service that you provided, there wouldn't be a HIPAA-related issue for using those kind of services.
I mean, they always have to consider that these have a social networking aspect, and so it may be seen by other people, right? It may be seen by their network or your network as a provider, because, I know I see people making, exchanging on Venmo all the time. Okay, so another question is from Craig Beckett. What elements are needed in each teletherapy note, and how do I assess the appropriateness of a client for a teletherapy session?
Sure. So in addition to what you would normally include in a progress note, there are 3 things that you want to make sure that you're documenting for each telehealth session you have. So that'll be your patient's full name. So basically a requirement that you make sure it is your patient that you're speaking with. Second, your patient's physical address. The reason that's so important, first, to confirm that they're here in California, and second, in case they go into crisis, you know how to get emergency services out to them. And finally, that telehealth services are in fact appropriate for that patient on that day, because things can change. And as far as what you're looking for clinically, I'm an attorney, so I'm going to defer to the better minds on that issue. Oh, did we lose Nabil?
Oh.
I think we have, I managed to freeze Nabil.
Oh, wow.
That's impressive. Hey. High five, Brad. So I know, Brad, we've had a question in the past that's come in regarding telehealth, and that's from associates who are looking to submit their hours under option 2. So there aren't too many of them, but what advice would you give to those associates?
So that's a good point. And so for option 2, we are seeing that there are some issues when it comes to option 2 has that 375 hours cap, whereas option 1, there's no limit on how many hours you're able to offer through telehealth. And also for option 2, based on the way that the weekly hours log is going to be, the way that it's worded, you can't log hours as both telehealth and as couples, family, and children hours. Any hours that you're doing with couples, family, and children via telehealth would count as telehealth only for option 2, whereas you wouldn't run into that issue for option 1. The challenge is that it would take action from the governor's office to be able to address that. And realistically, unfortunately, it's really not a priority for the governor at this time. He's focused on adding more hospital beds. He's focused on getting PPE for hospital workers. And so CAMFT is going to do its best once the crisis is over to see if we have a legislative opportunity to have a cleanup bill to address the issues with option 2. But for the time being, if you're having trouble with option 2, you may want to just switch over to option 1, unfortunately. And that would not be too difficult. You wouldn't have to get all of your hours re-signed on option 1 documents or anything. It's totally fine to submit both option 1 and option 2 forms, as long as when you submit your hours, you're adding a cover letter that indicates that even though you have both forms being submitted, you would like to go under option 1.
Right, exactly. And it looks like we've got Nabil back.
Oh, well,
Yeah, and welcome to the world of telehealth, right? How many of you have had this happen in a therapy session? So as a reminder for everyone, just here's my clinical suggestion is have an alternate way to contact your team, your clients. So make sure they have a phone and that you could text them or call them if this happens. So I cannot see all the questions that came in before. So I'm gonna need Marlene to help us out. But I'm going to answer some questions that I'm going to ask some questions that I can see right now. So Marlene, if you could text me or Slack me the questions. So a question from Barbara Devaney is, can we supervise trainees via telehealth? I have a feeling I know the answer.
Yes.
So who would like to take that?
I just posed one to Brad, so I'll take that one. So the answer is yes. So the BBS has come out to confirm that yes, in fact, trainees are able to receive video supervision. And again, it does have to be video supervision. You want to make sure you can see the eyeballs of your supervisee. It can't be over the telephone, but video supervision is perfectly fine for those trainees.
What about for those who are in private practice? So let's talk about associates.
So
associates in private practice.
Yeah, that's going to be a little bit different. So associates in private practice, under the statute, they must receive face-to-face supervision. And for the BBS, that literally means in the same room, if you can reach out and touch your supervisee, that's what you're supposed to be doing. Now, that being said, there is a waiver currently under consideration from the Department of Consumer Affairs, which is kind of the parent agency over the BBS. And so the waiver currently under consideration is to permit those associates in private practice to receive video supervision because, you know, the associate or the supervisor or both may meet those certain requirements where having that face-to-face interaction is not appropriate at this time based on, you know, our physical distancing requirements. So that is something under consideration. Our recommendation for those individuals who do have to have that video conferencing supervision, document your reasons why, right? You want to make sure that there's some reason that you're not able to meet face-to-face and act within the spirit of the law. So again, that's not calling your supervisee, it's having a video conference session.
Okay. And then I have a question from Niles Willits Spolin. I hope I'm not butchering these names, your names, everyone, but my name gets butchered all the time. So are Mfts considered essential providers?
And so the answer is yes. And so under the governor's stay-at-home order, mental health care providers are considered to be essential workers. And so you are exempt from that requirement, although it's really up to you in terms of whether or not you want to be seeing clients in person and then utilizing physical distancing protocols, or if you want to switch clients over to telehealth. But you are exempt as a healthcare provider from the governor's stay-at-home order.
Okay. And then here's an interesting question. Tori Morris is asking a question about employer is asking the therapist to hold groups virtually. And what are some of the consent privacy issues in doing group psychotherapy on a virtual platform? This is a pretty complicated answer, I bet. So I think it's a great question to answer.
It definitely is. So there's a lot that goes into that because you have the documentation requirements on top of, just kind of keeping track of everyone. So, it kind of behooves you to have a good sense of what to do when you're getting into these situations. So, making sure everyone is present where they are. And then with regard to the confidentiality, anything can happen, right? You can have a little kid sitting outside of the door who can be listening in on those group conversations. So, you may want to do something in terms of letting your patients know, here's what I'm doing on my end to be mindful of your confidentiality. Here's what I hope that you guys are doing as well. Hopefully you're able to find a quiet spot in your home, maybe your car. Some of the parks are opening up down here in San Diego, someplace away from, the home situation where, everyone is surrounded at all times. So it's a lot more difficult, but it is doable.
Okay, very good. I have a question from Elizabeth Lockhart, which is, what do you do when a family member walks into a Zoom session unannounced and you don't realize until a few minutes have passed? And I wanted that question answered from two sides. One is the therapist's family member walks in behind them or near them. And then second, the client. So are there any issues with that? So Brad, do you want to answer that?
And so for both sides of it, it's going to be issues related to confidentiality. And so I'll start with the client specific. You may want to address this at the outset of telehealth treatment with the client about what are protocols going to be for if someone walks in, and kind of just reminding clients that it's not appropriate for them to have a relative who's present or to have a friend who's there. And so just kind of making sure that the client's aware that that would not be appropriate. And then if that does happen, certainly, you can kind of take a cue from the client in terms of whether or not they're able to kind of ask that relative to leave, or if that's going to be an issue where you would have to end the telehealth session and then perhaps reconnect a bit later or reschedule that appointment. But addressing how you would handle that situation is going to be key at the outset. And then I would say from the therapist standpoint, it'll be a similar issue that ultimately you do want to preserve confidentiality, but a lot of us live with people, so it can be challenging. So I would say definitely have a conversation with those who live with you. And I mean, a lot of us have to do that actually. For example, before today's Zoom conference that we're having right now, I actually posted a sign on the back of my door that says, "You're recording a webinar." I talked with all of my relatives who are living with me about, not coming in, and then I've locked the doors. So ultimately, that's the precautions that I can take. But I would say just doing what you can at the outset, and then if it does happen, I would say catching it as soon as possible, and then just kind of either ending the Zoom video feed or if you're able to kind of shoo them away casually, then handling it that way.
Yeah, that's not as much of an issue for the cats and the dogs, right? That's not really a confidentiality issue. Okay, we're going to put a poll in here right now. So about noise, what noises or other interruptions have you had the hardest time managing during telehealth sessions? Kids and relatives, pets, outdoor noise like lawnmowers or traffic, partying neighbors. Who is partying in the middle of this?
I have partying neighbors.
Okay, and then, or all of the above, or all of the above.
Bonfire on Saturday.
So go ahead and submit your answer. I'll tell you from my part, planes, because I live in the pathway of a small airport, and I'm near Miramar, so I get planes over, and when I have the windows open, it's very clear. And then occasionally birds, because the birds outside are noisy. Okay, so I'm going to go back to some questions while we're getting this. And we have the poll. Outdoor noise is the most common thing, what we're seeing. Okay. Padmina Nagaraj says, can we use Zoom for telehealth after the shelter in place lifts?
So it depends. So if you are a HIPAA covered entity, that's someone who works with insurance companies sending PHI to insurance companies electronically, or have held yourself out as being a HIPAA covered entity by providing your patients with a notice of HIPAA privacy policies, then at that point in time, once this horrible time is over with, you would want to make sure that you're utilizing the HIPAA compliant version of Zoom. So my understanding is that there is a HIPAA compliant version of Zoom, and the way you know you have it is if you have a business associate agreement in place with Zoom. So Zoom for healthcare is in theory okay once the pandemic has passed, but again, it only really is going to be applicable to those HIPAA covered entities.
Okay. I have a question from Margaret Lint, and I have concerns about accepting a new client with suicidal ideation and how to manage it. So what are the legal and ethical issues regarding a suicidal patient in telehealth?
That's a great question, and it's an all too common one. I would say that, even before this crisis took place, the law says that you're not able to work with people who are not clinically appropriate for telehealth. The challenge is that when we're on a global quarantine, people who are otherwise not going to be appropriate for telehealth end up at least beginning with you on telehealth sessions. And so you'll definitely want to be assessing whether or not, I would say to the extent possible, assessing whether or not the client's going to be appropriate for telehealth. Are they a serious and imminent threat to themselves or others? Do they have a plan? And kind of just clinically assessing whether or not they'd be able to receive effective treatment from you, or if they need to be referred to a higher level of care. And then ultimately, if you are finding that they're not appropriate for telehealth at this time, perhaps offer some referrals to a higher level of care. But if, for example, they've had ideation in the past, but right now you're clinically determining that they don't have a plan or they're not a serious and imminent threat, you may want to let the client know that at this time you are finding that they're clinically appropriate for telehealth. But as Kristin mentioned earlier, you'll be assessing at every session whether or not it's appropriate for you to continue, and that if ever you do determine that it's not appropriate, you'll be giving the client a referral to higher levels of care. And that way the client can at least be prepared for if that step should take place.
Okay. Thank you, Brad. It is 12:28. We're gonna keep answering questions for at least a few more minutes, and then thank you for everyone who's come. I have 913 attendees. This is the most attended CAMFT event ever, as far as I know. So, so what we're gonna do is we're gonna keep asking these questions. So if you can stay, we're gonna stay. However, we understand if you only really wanted to be here for 30 minutes, that your time is up now. But we're going to keep asking questions. Also want to remind folks, we have a telehealth session. I need Marlene to verify it. I think it's Thursday with Kim Madsen of the BBS. So associate and trainee specific questions, write them down now and bring them, sign up for that lunch and learn. So we'll be posting this online on the CAMFT website, and we'll post it on Facebook and Twitter so people can find it pretty easily. It'll also be we'll figure out a place to put it on the homepage fairly quickly. Okay, so I'm going to ask a question for an associate that was, I thought I saw it. There's a lot of questions moving here. Oh, Narita Sandhu asked, as an associate, can we have our hours signed electronically at this time?
Yes, yeah. So thankfully the BBS has been really amenable to permitting you to have that electronic signature. So you're perfectly fine from the BBS's perspective. Okay.
Robin Kim has a question, and I think we kind of addressed it, but I want to make sure we address it specifically. I'm a supervisor in private practice with immediate family members who are at high risk for COVID-19 infection and complications. How do I handle supervision with my associate, those under supervision with me, while protecting the health of my family?
Sure thing. And so definitely you and your family's health comes first, and so I'm hoping that you're safe and well during these times. Kristin did address this earlier by mentioning that right now the BBS is working on, with the Department of Consumer Affairs, a waiver to allow for video conferencing supervision for people in private practice. At the time being, there isn't one in place, and so we're recommending that if you have to give video conferencing, that you document your rationale as to why, and then follow the spirit of the law. And then we in the CAMFT legal department actually discussed a few weeks ago a rather unorthodox kind of approach to this that would be defensible of meeting. And so perhaps if you want to take this option, you and your supervisee could meet in your own separate cars and then drive to a agreed upon location and then call each other and then be able to see one another.
And make sure you can see each other. Make sure you see each other.
You have a good point, yes. And so don't park between other cars or anything, but ultimately that would give you a defensible position because you are in person and it is face-to-face. But ultimately, if you're taking precautions, including not leaving the home, then you'll want to just document your rationale for why you can't do in person and then follow the spirit of the law.
Parking lot or the driveway of the supervisor or the supervisee, cars, separate phones, you could see each other, you're meeting the law. I mean, my hope is, so that legislation waiver is actually on the governor's desk right now. However, the governor is incredibly stressed about just the health of our citizens, right? And hospital access and the economy. And so this is relatively lower priority. And I know it's stressful for our colleagues, but it's there and it'll be addressed when the time is right. Okay, I'm looking for more questions. Kate Bosworth has a question. How will we be notified when the relaxed HIPAA requirements are removed? In other words, how will we know when we can no longer use non-HIPAA compliant options like Zoom and FaceTime?
Great question. So if you've been following our ever-growing FAQ list on the CAMFT homepage, we are keeping that up to date. So we will, I would, not to speak out of turn, but my assumption is we would notify members at the point in time when, if executive orders become starting to roll back, we'll keep that information up to date in the FAQ, certainly. And then I defer to my colleagues as far as other means of communication.
Okay, great. Let's see, I'm still looking for some more questions. Okay, Mary Chitola asks, when the stay-at-home lifted, will therapists will be allowed or required to wear masks even if clients do not? Also, is there going to be a requirement to have heavier cleaning practices in place in between sessions? And what if we can't find those cleaning supplies? I suspect the answer is it's too early to tell.
You're right. Yeah, I would say it is another great question, but ultimately it depends on what the landscape's going to look like. Right now, we're hearing different conversations about when the stay-at-home order will be lifted or relaxed. The governor has already outlined 6 criteria for when he will be comfortable with at least beginning to relax the stay-at-home order, and so that might include leaving the physical distancing requirements in place, and also we are talking a lot about the governor executive orders, but it might be that your individual county will have an order to wear masks or things like that. And so we'll keep, so definitely keep an eye on both governor and county executive orders, but at this time, it's not clear when that's going to happen or what it's going to look like. And so just from, I guess, a stress reduction standpoint, it might be good to kind of focus on the present, and then we'll address that issue once it comes. But that is a good question that a lot of folks are thinking about right now.
And I'll just tack on that there will be an FAQ coming in the next day or so on that topic. So basically, for you, always remember that, you want to make sure you're following the recommendations from the Centers for Disease Control, the governor, your local county health department, and your city as well. Because so many of these decisions are, at the city level, particularly whether you have to wear a mask. So
and while people are out, you could sort of think about your office and think, what do you need to move out of it, or what do you need to move in to make it safe? Like, do you need to have a big coffee table, or whatever other things you might need. Okay. Alejandra Alvarez says, is there specific criteria to determine if a client is appropriate to receive telehealth? I think this is an interesting question, so I thought I'd ask it.
So that's a lot of clinical.
Oh, yeah, that's true. That's
So,
true. Thank you. That's why
so I mean, at this point in time, you know, the clinical has a layer of the public health aspect on top of it. So getting to the earlier question of, you know, treating a suicidal patient, you know, perhaps it, you know, on a normal day, that person would not be appropriate for telehealth. However, given the circumstances, you know, perhaps there's, you know, no ability for you to, you know, appropriately treat them in a face-to-face setting. So, you know, perhaps there's a layer of, you know, public health awareness on top of the clinical concerns that you would want to go through in determining whether someone is appropriate for telehealth.
Thank you for that. And that's a good reminder that our attorneys are obviously not clinicians. So clinical questions we really can't answer.
You don't want my advice there.
So I would also add that even though this is kind of in the clinical territory as well, in addition to looking at kind of clients, you know, do they have clinical symptoms that are so significant that that they're not appropriate for telehealth? Another issue that we oftentimes get is when there's couples therapy and the couple is so volatile that they're not able to effectively communicate with each other on Zoom, and so they're kind of cutting each other off and kind of yelling. Those are also issues to be determining in terms of, you know, is this client appropriate for telehealth? In that situation, it might be appropriate for the couple to kind of get individual treatment. And then once they're at a point where they're able to talk without kind of, I guess, effectively communicate on these telehealth platforms, maybe then they're able to come back. But I would say, in addition to just suicidal clients or clients who have very severe symptoms, also be considering, you know, the communication piece for couples therapy.
Okay. So I have a question from Candace Newsom. Are there any sample informed consent forms for telehealth on the CAMFT website, specifically forms we can send if we are only communicating via email or messaging, not in, you know, so any?
I believe that we're currently working on one. I was speaking to another attorney at CAMFT, and so don't quote me on this, but I do believe that one is being worked on, but ultimately, right now, there's not a requirement for an informed consent. Verbal and documenting is okay, but there may, if there isn't one now, there may be one in the near future at some point.
Okay. I'm looking for questions that aren't clinical, and I'm saving some associate questions for Kim Madsen, who is really the expert on BBS stuff. So, so we answered that question. I'll leave this. I'll put this question out. It's a pretty broad question. Can you talk about telehealth working with children 12 and under? I'm not sure there's anything you guys can say because it seems more of a clinical question, but talk while I search for another question.
Sure. So I think that's, you know, getting to the issue of clinical appropriateness, right? So if you maybe are doing play therapy with a 2-year-old, are you able to appropriately treat that 2-year-old, right? Or are there other things that you can consider? Maybe some parenting work. If, you know, the child is not really able to engage with you. So it's kind of being creative and how are you able to help your patient without providing that treatment that you typically would. I mean, whenever you're distinguishing someone who's 11 and younger versus the 12 and older, to me, those ring in kind of consent type issues. So I think I'll leave those for another day. But you know, it's going to be up to your best judgment as to what makes the most sense. You know, certainly if they're younger, perhaps there are issues of confidentiality. Perhaps the parents are more apt to be in the room, certainly to set up the video conferencing to begin with, and also to close out sessions. So, you know, making sure that the kiddo's alone, you know, at some point in time for their confidentiality, depending on the age. So, you know, coming up with creative ways of, you know, maybe a little kid turns around and, you know, swings the laptop around carefully, just to confirm that there's not, you know, mom lurking in the corner somewhere.
Okay. Benelia Terry says, can you clarify the coding for telehealth and modification codes for Lmfts? I don't know if that's a question you guys can answer, so I'm just...
Oh, that's a great question. And so when it comes to billing for telehealth, you would just use your regular CPT code, so 90834, 90837, 90846, etc. Use your regular CPT code and then add a modifier of 95 at the end of that for telehealth. And so for example, if it's going to be a 45-minute session via telehealth, that's 90834-95. And then in some situations, like I believe the CMS 1500 form requires your place of service code, which is typically 11 for in office, but for telehealth, the place of service code, in case you ever have to offer it, is going to be 02. And also, I would say that there are different insurance companies that have their own rules. I believe that there are some insurance companies that use, I think they're called GS codes, or their own kind of, they have their own additional rules for telehealth. And so make sure that you're aware of any kind of additional coding requirements for different insurance companies that you're paneled on.
Okay, Linda Block has a question. How do I make sure a client is in California if they are being referred from a teletherapy organization I am signed up with?
So, I mean, at the outset of your treatment of the patient, if you have paperwork that they fill out, you know, if there's a California address on there, you know, just again, every session you do need to confirm where the patient is physically located. And sometimes that's not really compliant with some of those more 2020 platforms that are out there. So some of the platforms for, you know, telehealth services actually tell their patients that they have some level of anonymity, and that just doesn't really jive with your requirements as a California licensed therapist. So, you know, really setting the expectations with your clients of, I do need to know who you are, I do need to know where you are at the outset, so that you're able to, you know, have an understanding of, is this patient here in California, or, you know, do I need to call Colorado to find out if I can treat that patient or not? And then, you know, get creative. You know, a lot of people work with the homeless population, so perhaps that person doesn't have a physical address where they're going to be. You know, what are the cross streets? Just trying to figure out, you know, how can you best serve your patient and best stay in kind of the spirit of the law of your statutory requirements.
Okay, Precious Owens says, if since and I am continuing to gain and log my hours, do those hours logged in as just telehealth or individual or both?
Did you mention that if you under option 1 or option 2?
She didn't say that. So
I'm guessing option 2. That's the only time when that comes into play. So we actually answered this question earlier.
Okay,
well, while you were gone.
Oh, okay, good.
Oh, yeah, that's a good point. Yeah,
okay. Our Lavelle Jacobson asks, are there more lenient guidelines for telehealth if a client is, if in-person therapy is not an option right now? For example, I have a client that has been chronically suicidal, and normally I would not see her with telehealth, but that is all I'm offering right now, and she's been unable to find other resources as well. So.
And so there's not more lenient guidelines. What I would say is that there is still that requirement that somebody has to be clinically appropriate for telehealth for you to be able to give them telehealth. And so you would want to do your best to be able to help them find referrals if possible, maybe to a PHP or IOP program. And I would say that as you're helping to identify resources that might, certain higher levels of care for the client, always be aware that if you're finding that the client's at a place where they're a danger to themselves or others, then they're in the territory where a 5150 might be appropriate. And so even if you haven't found a place yet, just knowing that having that step in the back of your mind in case you ever do have to take that approach might be a good idea to know in advance.
And I'll just add on, you know, if you're in that terrible spot where you're not able to refer the patient on, document why you're making those choices, right? If anything goes wrong, that's your support system there. It's your documentation.
It's always document, document, document. It's like, you know, location, location, location for real estate agents, MFTs, and for all behavioral health. Document, document, document.
Look, if you don't write it down, it never happened.
It never happened, exactly. Wendy Giggy says, I've heard that insurance companies are going to waive clients' copays during the COVID-19 pandemic. So are the insurance companies going to make up the difference when they reimburse us? If not, are we taking we're taking a reduced rate of reimbursement for services? So any information on that as far as?
Yeah. So I am aware of Anthem as one of those insurance companies that is waiving those copay requirements for their insureds. And Anthem, we actually received confirmation from them last week that they are going to be covering those copays themselves. So when you do your billing, make sure that it's clear that you're looking for your copay in addition to your regular fee from Anthem. As far as other insurance companies, if you're on the panels, I would recommend that you reach out to them and get some clarification as far as whether or not you should be accepting those copays or not at this time.
Okay, I want to get back to the question that was being answered when I interrupted. So Lena Lebovich wanted to get clarity on that answer, so I'm going to bring that question back. Thank you, Lena, for pointing this out. So counting kids' hours and individual psychotherapy hours, this was, I think, a question that you were answering when I came back into when I got back into the Zoom. So can one of you sort of state the question completely that came back then and then finish your answer?
Yeah, I pose the question. So basically, the question is for those associates who are counting their hours under option 2. So that is only those associates who will submit their hours this year. So if you're submitting your hours under option 2, whether you can count telehealth services under the telehealth counseling bracket, or if you're able to count them under the very kind of specific buckets of child, family. And so Brad's answer before, as is ours, is no. Unfortunately, you have to count those hours as telehealth counseling hours at this time. So there's not that option to, if you're providing services via video conferencing or telehealth, they do have to count as telehealth counseling hours.
So they don't count for the child requirements?
No. And so our recommendation is to count your hours under both option 1 and option 2 to see what makes the most sense for you so that you can, mitigate any potential loss of hours.
And you should probably track your hours, even if it doesn't count. Just make sure you know which hours were in child, which were couples, which one were adults. So you, if they do waivers, you have the data, right?
Right.
Okay. Let's see. I'm still looking for some more questions. We're down to 571, so a lot of people are still here, so I appreciate it.
Wow.
Oh, here's a great question. Michelle Holguin asked, if I have a technical issue and have to switch between video and phone, do I need to detail that in my progress note in case of an audit?
I would say if it's relevant to what took place. And so, for example, if the client, for some reason, has a more difficult time communicating via phone and you believe that that might have impacted the answers that they provided to you or the services that was given, then there's a clinical rationale for documenting that. But I would say that it seems that the kind of thing that you'd be able to document pretty quickly. And so there's no reason not to, but I would say from a requirement in terms of what to include in notes, you wouldn't necessarily need to unless it's relevant to the services that were given, but there's no reason not to, if that makes sense.
And I would just add, the only other thing to think about is from a billing standpoint is if your insurance company that you're billing with has a distinction between synchronous and asynchronous telehealth. So it's that difference between perhaps they want the 95 modifier or the GT modifier, to think about that when you're filling out your billing paperwork.
Okay, and something related to that, but a little different, is Sari Colley's question. Can an MFT provide telehealth on the phone only?
Sure. Yeah, I mean, so telehealth is, just an umbrella term for any type of counseling that's not that direct face-to-face. So it could be video conferencing, telephonic, texting, emailing. So if it's clinically appropriate, or if you are working with a patient population that doesn't have access to a laptop with a video camera, maybe that's your only option. So yeah, there's no requirement that you do one particular thing.
Okay. There's a lot of questions about specifics, like what's the preferred, what are the preferred platforms? I'm going to guess that that's really outside of our scope of answering. Like we can provide a list. I think we do have a list.
We do. So
Non-sponsored
we do have a list on that FAQ page of ones that the Office of Civil Rights specifically called out as being appropriate. And we also have kind of addended that to include certain specific platforms that we know our members like to use, like Simple Practice. So
Right.
take a look at our FAQ. We do have that information listed there.
Yeah. Okay, let's see, what else we got? I've been advised that clients have the right under HIPAA to use non-secure methods like FaceTime or Zoom, even when we are not in a pandemic. You need to explain why FaceTime is used or not advisable, but the decision rests with the client. They should send a release. Is that your understanding?
That is not. And so when it comes to non-pandemic times, the issue for HIPAA is going to be you're required to use a video conferencing software that offers what's known as a business associates agreement, or a BAA. And that's basically an agreement on the platform's end to follow HIPAA. Not every platform offers that. I don't believe that FaceTime or Skype do. And so if that changes by the time that this is all over with, you want to confirm that with either Skype or with Apple. But the issue with those platforms in non-pandemic times is that they don't offer BAAs. And so you would not, even if the client were to sign a waiver, you would still be in violation of HIPAA for using a platform that's not offering a BAA. And so once this is all over with, you want to make sure that whatever platform that you're using is offering you that business associates agreement. And then that's what HIPAA requires.
Okay, great. I don't think we answered this question, but I'm working with a couple. One partner who's using her insurance lives in California, partner lives in another state. Can I work with this couple via telehealth? And not in the question, but I'm going to say implied in the question is, and bill that the first insurance. So
I mean, this gets back to the earlier question of, in order to practice with a client in another state, that's going to be entirely up to that other state's licensing board, whether you're permitted to practice with a client located in that state. California requires you to comply with whatever those rules and regulations are. I'd recommend that you definitely take a look at that list of all of the licensing board's contact information and reach out to that other state to see if you are able to lawfully practice in that state. And then, again, it's making sure your malpractice will cover you if, for whatever reason, you are able to practice in that state. So it's, as far as whether insurance would cover you, I would defer to the insurance company whether they would cover that.
okay, this is a question that you may have encountered in some calls before. Susan Hill asks, in court-ordered anger management classes, they're usually required to be in person and not allowed to be online. Is a video session allowed, or is that considered online?
And so if the court's ordering to have in person and there's not going to be any exceptions, then at least from the client standpoint, then they would have to follow the court order. Perhaps they could, through their attorney or themselves, reach out to the court and kind of get clarification from the court. From your standpoint, the provider, in terms of whether you'll be offering in-person, depends on, for example, if you're in a high-risk category, you may not want to. And so ultimately, if the client needs to have that in person, then it's really more of a requirement for the client as opposed to a requirement for you offering that. And so, for example, if you're not offering in person, then you may want to do your best to refer them to somebody who is offering in person, or offering the client the choice in terms of, do they want to receive telehealth, and then document, and then of course you'll document your rationale for why you have to give telehealth, and then the client can take their chances when it comes to complying with the court order, as long as they're aware of the issue and they're making their own choice. But it really would be up to the client to determine how they want to comply with that court order, and up to you in terms of, do you want to be the therapist who's offering them in person?
Okay. Paulina Trujillo Perez asked, I work with a disadvantaged population, and many of my clients don't have the technology to do telehealth or the infrastructure. Can I do phone sessions?
Yeah, so I mean, again, telehealth is, whether it's video conferencing, telephone, texting, you know, for you, you're certainly able to do what makes the most sense for your population. The one thing for you to think about is, you know, if you're working with an insurance plan, that you expect some pushback as far as, you know, why did you choose to only have telephonic sessions with your clients? Again, just make sure you're documenting why it was appropriate, right? If John Doe didn't have access to a smartphone, as many in the indigent community don't, you know, document what the technological hurdles were and why you did what you did.
Okay. I'm not sure if you guys can answer this question. What are the guidelines regarding Google Voice? Do we need G Suite right now, or during the pandemic, is it okay to use regular Google Voice? Also, can we send worksheets or other materials for clients over this as well?
That's an interesting question. I would say that, well, and then Kristin, feel free to kind of give your thoughts on this as well. But I would say that for Google Voice, because it's not video conferencing, the Department of Health and Human Services, their order on relaxing HIPAA requirements only, to my knowledge, applies to video conferencing. So you would likely need to have a business associates agreement in place to be able to use Google Voice, because that's going to be an internet-based phone system.
So the only thing I would add is, again, this is only going to impact those HIPAA covered entities. So, you know, once this is all over with, they'll need to have a business associate agreement in place. Now, the one wrinkle there is that if it's just telephonic, under HIPAA, those telephone conversations are not considered to be electronic communications necessarily. So that may be one aspect of the Google suite, which I honestly am not familiar with as far as, you know, what its capabilities are. But, you know, that may be one aspect that perhaps does not require a business associate agreement, depending on, you know, whether Google stores that conversation. If they do, then you absolutely would need a BAA if you are a HIPAA covered entity, regardless. So.
Okay. I am looking at our time and we're almost out of time. So I'm going to stop asking questions right now and start wrapping things up. I want to thank all the CAMFT members and non-members who came to this session. This has been a real treat to meet, to see folks. We had over 900 attendees, 913 at one point. Amazing. Thank you for that. We had a lot of questions about associates and associate questions. And I'm going to hope that we can save these questions and repeat them with Kim Madsen. I don't have the date that Kim Madsen is meeting with us, but we're going to do the same thing with Kim. It'll be me and Kim. I might have someone else on in case my video goes down. But there's a lot of BBS, a lot of associate questions. So we're going to try to answer all those. I didn't intentionally put them in because I know we have that one coming up. So once again, I want to remind folks to use the CAMFT FAQ. Kristin, Brad, and the other members of the legal team and CAMFT staff worked diligently to compile this huge list of resources. And it is organized there. So please go to the camft.org website. You'll see it on in one of the, it's across the front. You'll see it. You can click there and go to this FAQ, get information on telehealth, platforms that you can use. We are not making recommendations about platforms, as just as a heads up. However, you know, honestly, use your networks. This is where the chapters play a great role. On chapter listservs, I'd encourage conversations about Zoom versus, Doxy seems to be very popular, Zoom, in Simple Practice. CAMFT does have a relationship with Simple Practice. We get an affinity partnership with them. So if you do choose Simple Practice, you are also supporting CAMFT. But anyway, I want to thank everyone. Any final messages, Kristin and Brad?
No, thank you all so much for coming out. This is overwhelming how many of you actually came out. So I hope you have enjoyed yourselves, and we'll see you next time.
Yeah, thank you all for being here, and we'll see you on the phones.
Yes, and
Thank you.
well.
Feel free to call us with your legal and your ethical issues. Any questions you didn't have answered, we will be happy to answer them if they're within our scope. So we always, like a good ethical MFT, we stay within our scope of practice, our scope of competence.
We do.
So thank you very much. Please, everyone, stay safe, stay healthy, stay physically distancing, and we will see you later. Thank you. Bye-bye.